My name is Melanie Coffin, and I am the Executive Director for Disability SA. I'm joined by my colleagues, Deborah Sharvin with the City of San Antonio's Disability Access Office and Jane Passione with the Successfully Aging and Living in San Antonio Collective Impact at the San Antonio Area Foundation. It is my honor to thank you for joining us today for the first in a series of 5 conversations around cultivating community resiliency, housing, and the disability lived experience. We are here to learn from the diverse perspective of the disability community as panelists share their experiences and strategies for identifying and removing barriers to finding affordable and accessible housing here in San Antonio. Captioning is available by clicking the CC icon on your Zoom toolbar, and we welcome questions and comments to be placed in the chat. And if we don't get around to responding to you today, we will be following up with answers and additional information following the session. We have a short session today, and out of respect for your time, it's my pleasure to introduce today's moderator, Jane Passione, who will lead our panelists through a reflective discussion. Jane serves as the Managing Director for Collective Impact at the San Antonio Area Foundation, and as such, she's leading the charge to reframe aging in San Antonio through the Successfully Living and Aging in San Antonio Collective Impact. Jane has a strong vision for supportive and accessible San Antonio, where older adults and individuals living with disabilities can thrive. She was recently recognized for her efforts as an inaugural Diversity and Inclusion Award recipient from the San Antonio Business Journal. And with that, I'll let Jane start with some opening remarks and get this discussion started. Jane?
Melanie, thanks so much for that wonderful introduction, and thank you for being here today. I see some familiar faces on the screen here. So again, welcome, and it's a privilege for me to moderate the discussion today. I want to introduce our panelists. Anne Larmy is a retired medical anthropologist, formerly with UT Health. She has served on both the City of San Antonio and Bexar County's advisory committees for persons with disabilities. Diagnosed with MS in a progressive disability in 1989, she's been using a wheelchair for the last 15 years, lives on her own in an older home built in 1954, which she has been adapting through several different remodeling projects. I'm looking forward to hearing what you've done there, Anne. Our next panelist, Chris Salas, is the Executive Director of Rolling Inspiration, a local nonprofit organization that convenes and facilitates support groups for people with mobility disabilities. He's also the president of the local chapter of United Spinal. In April of 1997, Chris had a car accident and now uses a wheelchair to navigate the world. Chris lives on his own and is currently renting a 1-bedroom, semi-accessible apartment. And I'm looking forward to listening to or understanding what semi-accessible means. And last but not least, I welcome Todd Hargrover to our discussion. In 1986, at the age of 19, Todd sustained a C5-C6 spinal cord injury. A few years after the accident, he started a small business, ADI, out of the garage of his family property with one product originally designed for him. Over a 20+ year period, he grew the business and positioned ADA as a leader in the wheelchair mobility industry with worldwide sales and distribution. In 2015, Todd sold ADI, but continues to enjoy technology and studies many industries for design and inspiration. Todd currently lives alone and is renting an apartment downtown along the San Antonio Riverwalk Museum Reach, which is totally awesome. So Todd, we all want to be living where you're living. Trust me on this. Although I think Anne's place is good too. And I'd love to go over to Chris's house because I know that he's a wonderful cook. So I've seen many pictures. Anyway, thank you for being here. Oh, self-disclaimer, I'm a wheelchair user too. So I'm like totally here with my peeps. I feel like, this is the first time we've also gotten together on screen and talking about something so important as housing. So I've got a few questions. If you attendees, if you have any questions, Melanie's going to be moderating or looking at the chat. Please put them in there as your questions pop up. So I'm going to give the first question to Anne. And Anne, what are some of the challenges or barriers to finding and securing your current living arrangements?
Well, my situation is, it kind of grew organically because I have a progressive disability. I have multiple sclerosis, and it's gradually been getting worse. I went from cane to wheelchair, and I have this house. I had a house when I was still walking, but I feel miraculously I've been able to adapt it to my needs through different remodeling projects as my disability progressed. So I was able to, I remodeled my bathroom. I made an accessible shower without a lip, grab bars. I brought my washer and dryer in from a shed that was outside. It was outside in a shed. I raised a floor in the back room, and then I added a ramp on the back. And it was really a challenge to keep ahead of the changes they need. I often think it's like running out of a burning building with the timbers falling down behind me, because I made the changes just in time for when I really, really needed them to be able to keep living in my house. But I feel I'm really fortunate because my house was built in 1954, and not many houses this age, I think, have a really good plan to be adaptable, that is adaptable to a wheelchair. So what my issue now is, I'm actually planning to move to a continuing care retirement community in another state. And I'm having an issue there because even though all the apartments are technically ADA accessible, I'm looking at the floor plans and they don't really all meet my needs because I have a certain bathroom configuration that works with my wheelchair. So that's my big issue, because you can't really move a toilet. So that's my big issue now, looking for housing.
Okay, and thanks for sharing that. And just so the group or attendees understand that the housing modifications you did were out of pocket for you, correct?
Oh yes, oh yes.
Okay, just to make a note. I know that they can be costly. I'm going to ask the same question to Todd. Todd, what are some of the challenges you found with securing your living arrangements?
Well, I mean, as with everybody, I mean, we location and pricing. So, I mean, that is certainly a concern. But then for an individual such as myself that uses a wheelchair, access, and it's access to the apartment, access to parking, your mailbox, packages, everything. So, looking for a place that you want to live in, that's just, or the location that you want to live in, that's just challenge number one. But then all these different access points just to get in and out of the apartment, just to do your daily things that you need to do. I mean, that's another one. And then once you're inside, having the access, as Ann said, to the bathroom, to the toilet, to the sink, to the shower, all these different things. I mean, it all comes together, and it's a lot to have to look for, to find that perfect place so you can live comfortably and safely and happily.
Thanks, Todd. I guess I'm thinking about Todd, Chris, and I have had spinal cord injuries, and it's sort of, stopped right there, right? Where Anne's gone through this progressive, so she wasn't knowing where this was going to go or what the timeline was. Just something to think about too, I think. Chris, I know we're not going to have too much time, but Chris, I want to ask you the same question. What are some of the challenges that you'd like to share with us with finding and securing your living arrangements?
For me, I think it was more about educating the lingo. When I would call ahead of time to see if they had accessible apartments, they would say, yes, we have apartments on the first floor. And that doesn't necessarily mean accessible, it just means you can get in the door. So I would go to these apartments and get in the front door, and I couldn't go anywhere else because the other doors were too narrow. And so I think that's a big important thing, is educating the population on what the actual definition of accessible means. And So I started calling and asking if they had wheelchair livable apartments. And you would have thought I'd asked them a complicated math question, because they had no idea what I was talking about. Like, what do you mean? And just like everybody else, it's access, making sure it's on a bus line, things like that are, we have the same problem as able-bodied people trying to find the right place, the right cost, right? But then we have these additional barriers that we have to make sure. And number one, it's always going to be bathroom. I mean, you see, we've all three of us mentioned that exact same thing. I'd say 99% of the apartments that I was looking at ahead of time had the standard tub, commode, sink, and configuration, and you just can't fit a wheelchair in there. Not even to get close to a tub to transfer, much less get in a walk-in or roll-in shower. And so that's the reason I picked this apartment that I am now, is because the bathroom sold me, and everything else was not technically accessible, but because I knew I could work around it, that was the reason why I chose this place.
That goes down to your semi-accessible living arrangement right now. The bathroom was the number one key for you.
Right, and they were really nice enough to actually, out of their own pocket, is change my tub into a roll-in shower. Really the other modifications that I had them do is change out all the doorknobs to door handles.
And they did all of that without cost to you, Chris?
Right, right, and that's very rare for complexes to do that. So
I think, Debbie, that is rare, isn't it? I'm looking around going, is that a unicorn right there? Is it Chris just, like, whoa, Chris is.
I'm a charmer.
Yeah.
Yeah.
Chris found
Chris,
a unicorn. Chris did find a unicorn because a lot of times what happens is people don't understand how complicated the actual accessibility laws are that cover housing and what they do cover and what they don't cover. And so we come to this mix of Fair Housing Act and the ADA and some of these other laws. And really most of the time under the Fair Housing Act, it covers just kind of multiple housing units. So this is not going to be for a single family home, but usually most of these things are at the tenant's expense to change, and the landlord can expect those changes to be returned to the original condition. So there's a lot of potential extra costs in those changes. So Chris found a good unicorn.
Thank you. Thanks, Debbie. Okay, so next question, back to Anne. What are some of the accessibility features in your home that you depend on and can't live without? You mentioned the toilet configuration. I get that too, because I like to transfer one way. That's my strongest side to do it. But are there any other ones that you would sit and go, this is a deal breaker, I can't live here without this?
Well, of course, a ramp. The ramp, that's the main thing. Floors all on one level, which I had to remodel to do that because I had a step down into my back room that goes to the back door. A shower without a lip, grab bars in shower and toilet area, bathroom sink with space under it for a wheelchair to pull up under it, a low mirror. You wouldn't believe all the places I go in public where I can't even see myself in the mirror. Supposedly accessible restrooms. Anyway, that's neither here nor there. Pocket door, I have a pocket door into the bathroom, which is really important because the door gets in the way. If it were a regular door, it would get in the way. Or it would be really hard to close from a wheelchair. I have a washer and dryer that are the old fashioned, they're really old. They're like 20 years old, but they're the old fashioned height. They're, just kind of counter height. And they're inside the house, so there's no steps to access them. I have a microwave at counter height, so I can get my food in and out without dropping it. Cabinets I have one cabinet that was built custom made to wheelchair height. And then the other ones I put pull down shelves in the cabinets. A drawer dishwasher, this is really important for a wheelchair because you can just, you don't have this big thing to negotiate around. A refrigerator with a bottom freezer that opens to the left so I can access it from the sink area because I have a really narrow galley kitchen. And I have a flat stove that I can just drag. It has a flat grate. I can drag pots and pans right over it. And then there's no drop off. You know how some of those stoves have like a drop off between the grill on this or the grate on the stove to the counter. I don't have that. It's just all flat. And then my last thing is I have wide hallways. So it's possible to turn the corner into rooms off the hallway. And I have an open floor plan, so I can basically go all through the house, usually without having to make those turns. So that's it.
That's a good solid list, Anne, and I will be coming over to your house because I want to know
Okay.
about this drawer dishwasher, because we're not given a manual when we join the disability group of, hey,
Right.
you need to be looking at these things. So only when you're sort of up and about and navigating together, you're like, oh my goodness, I could use that or whatever.
Yeah.
The one thing I didn't do in my house, which you did, so I'm sort of jealous, was the pocket door in the bathroom.
Yeah, that's fantastic.
That was something that I wish I had thought about and just missed. So thank you for sharing that really comprehensive list. Okay, let's see, Chris, do you want to answer that question? What are the accessibility features in your home that you depend on and can't live without?
Mine are more technologically, I guess, is a better word for it. As far as with regards to spinal cord injuries, we have problems regulating our body temperature. And so I have a Wi-Fi, Wi-Fi, first of all, is key, but I have a Wi-Fi thermostat that I can control with my Alexa, or I can control it from an app on my phone. Having a ring at the door and a door lock that's actually remote control where I can unlock it via an app as well. Because you have different nurses and different people come to visit, and that's kind of like a modern age people kind of, but you can unlock it if I happen to be in bed at the time, or as I'm waiting for somebody. So it's more technology driven, and these are things that I did have to pay out of pocket. The complex did install this stuff for me, but those were the things I had to buy out of pocket, and those are really, it's kind of strange that we don't talk about just your technical stuff anymore. It's more about the convenience out of it all more than anything else for me.
I definitely think embracing technology is a key to living and aging in place and community. So definitely agree on that. And also the internet access. We need to make sure people with disabilities have connectivity, and it's just so important. So thanks, Chris, for sharing that. Todd, same question. What are some of the features in your home that you depend on and couldn't live without?
Well, and I agree with Anne. I mean, her long list of accessibility needs, I mean, as people in wheelchairs, just the access to the kitchen, the access to the laundry, all the aids, I mean, all the daily living things that everybody else does, we have to do as well. The more things that we can do on our own, the less we have to rely on others and pay for others to do that for us. And then what Chris had said, my answer is, I mean, the smart home technology. And last year during our big snowstorm, when we had electrical outages, it was like, holy smokes, what's going to happen when the electricity goes out and I lose my electric bed, the ability to raise my bed up and down and roll and so forth. And then all the smart home technologies, to be able to access my door locks, my thermostat, my lighting, my cameras, all those things are so important for us. Cameras and door locks, when you're not able to just jump out of bed and go do something, it's the peace of mind having that smart technology that allows us to still interact, still know what's going on, but from our bed or from wherever we might be confined to, for lack of a better word. So smart home technology is a big part of it, all driven by good old electricity.
Thermoelectricity. Okay.
Yeah.
I just think this is such a great conversation. I'm looking around my house going, what couldn't I live within? I actually had this house built, so I was able to have the nice access from the garage into the house, and sort of really level it out. Although I didn't think about the pocket doors, but I made sure doors were wide enough. But also I've embraced technology also, and have the digital keypad to come into the house if I needed someone to come in. And one of my favorite ones right now is the one that is on the garage door. So I literally just got that last year. I must have been one of the old ones, but when I go for a wheel in my neighborhood, I want to be able to come in and I was taking the door clicker. That was old school. So now I'm up to date with the latest technology when it comes to that. This is a good conversation. Melanie, do we have any questions in the chat? Let me see here.
So basically the question in the chat, Jane, came from Pete. Basically, it's like, do we have data on the number of accessible units needed in San Antonio, so we can understand the scale of need here in the community? And so right now our office would be able to get data based on the disability types and kind of breakdowns of by age and things like that. But we probably would have to do some digging to get some numbers to find actual accessible housing requests, or see if we can try to track that down.
That would be excellent. I think that because we have in San Antonio such an older housing stock, I would say that most housing out there is not accessible. I think a number I saw was like less than 3% of accessible housing in the nation is really accessible. And I think this series is going to open up our eyes. The whole series that we've got going on here, this is mobility disability. And I think it's very often easy to just dump everyone into one group, but you're going to see that we all have so much different needs. So today we're looking at mobility, people who are using mobility device like a wheelchair to navigate around their homes and their communities. But I think the other subject is, and I see Pete there and Emily, and Anitra, the visitability of not just this house that you live in, but the areas around it, right? The actual neighbors. And I can only get to maybe one or two of my neighbors' homes to their doorbell, right? I'm not saying I can get in their house, but I can get to their doorbell. The other ones, I can't even get to their doorbell. So in an emergency, it's going to be really difficult for me, right? In an emergency, if I had one, that would be hard. Here's another question, and I'm so happy that we've got a good crowd here, really thinking about how people with disabilities are accessing not just their homes, but the communities around them. But with that in light, the next question for our panelists is, what is one insight or solution? And I'm going to say, let's open it up and have, if you've got more than one, let's do it. Or solution that you'd like to share with the group concerning accessible housing. I'm going to hand that off to Anne. What would you like the people here to know about?
What I want to say is it's not that much effort to plan for accessibility for any remodeling project or any anytime you're building a house or apartment. And no matter what the status of your client, no matter what their age, no matter what their health status, everybody should, think ahead, because they might want, first of all, they might have a disability in the future, or they might have a friend or a relative who wants to come and visit them. So, and I don't think it's that much effort to plan it right into any remodeling or building project. And if you plan it ahead, it can be integrated into the design and made to be very attractive. Like I have a ramp and deck arrangement that's all integrated into one, and it looks really attractive. It doesn't look like a tacked on ramp on, on a house for a person who is in a wheelchair. So that's all I have to say, is just, plan ahead, integrate it into the design, and make it look pretty.
I've got to add, I think making it look pretty is so important, because I think at the beginning, of when people were coming out with disability items to help age in place or live in place and live in community, it was very sterile. It was looking like you were at the hospital. It was something that someone would look at and go, whoa, I don't want that. Even if I have to struggle, I don't want that. But now there are so many items out there that we can use that don't take away from the beauty of your home and are seamless, that are out there. But you know what it is? It's people have stuff stuck in their memories of, oh, that looks accessible, or that's, I'm going to use the word handicap. You know what I mean? That's that piece. And I think we need to reframe, change the narrative about what disability is and what us as people in the community need. I just think that's really important. So the beautification thing, definitely agree.
Yeah, like
Hey, Chris.
if you go into my kitchen, you wouldn't even know that it was for a person in a wheelchair. It's just all, everything is just, kind of built in to be usable and attractive.
It can be done, but just like you said, it takes planning. It takes planning, and everybody knows on the screen that knows me, I'm into barrier-free living. Why are we building houses with any type of, why are we doing that? Then we have to come back and because at some point we're going to need this. If we're lucky enough to age in community, we're going to need this. So I'm the person that's out there saying, why we need barrier-free housing, not just for today, but for tomorrow and the next day and the next group and the next people coming along. So Chris, what would you like to share an insight to accessible housing?
Well, I don't think if you, again, planning ahead, doing it from the onset, as far as, the cost effectiveness, it'd be a lot cheaper. And again, I'm trying to get away from the term accessible housing and call it more of a universally designed units. So that those with disabilities or non-disabilities can all, share the same space. And not be something that's pigeonholed to a certain demographic, because that's what holds people back from doing things that are for a specific group of people. Because if you don't have that kind of business, then that's just going to sit there empty, or you'll put someone here that doesn't necessarily need it. But if you have this universally designed unit where anybody can stay and live, I think it'd be a lot better. And again, this would be something that has to be planned ahead of time, because retrofitting things are so much more expensive than doing it from the ground up. And so, asking those that are making decisions to do that from this point forward, it should be more of a no-brainer than a why.
Mm-hmm.
Okay, it says here, what did Chris call it? Universally, I think
universally designed units.
Yeah. Okay. Todd, thank you, Chris. Todd, what are your suggestions?
Well, as Ann and Chris both say, universal design. If it works for us, it works for everybody. So, having the countertops, having the wider doors, etc. Again, if it works for us, it's going to work for everybody. And we're, working towards getting away from that stigma that a home that is accessible is going to look like a hospital. That's not the case anymore. We can design things very, very beautiful. And for me, modularity. One of my solutions was when I moved into this apartment, I made the apartment complex took out the vanity, and then I went in and built my own modular type countertop for my sink and a cabinet. That's really all I needed to be able to roll up underneath that sink. But the modularity design of it will allow me to take it to my next location, wherever that might be. So planning ahead, because we do have to pay for this, to make it accessible, as well as you have to pay to put it back to the standard that it was when you moved in.
And that's really interesting, Todd, that you said that you've designed something that you can actually take to the next place.
Correct.
Something
just thinking ahead, because we're paying for it going in and we're paying for it going out. So just trying to limit that cost, as well as the burden of having to rebuild this if if you move every few years, because I mean, one just doesn't know what's happening down the road.
Right. So when you did your apartment pay to have the piece removed, or did you have to pay them to remove that and then bring your stuff in?
I did. I had to pay for them to remove it. And then I paid out of pocket to have my own people build and install the cabinet.
Interesting. Wow. There's definitely, when we're looking at, also, I'm just curious, how many square feet, Todd, do you live in?
I have a 2-bedroom, so it's right around 1,100 square feet.
And Chris, how much are you in?
I'm not even sure, to be honest.
Okay.
I was more about how it would work rather than
How
the
it
size of it. That was kind of more of my concern.
I'm just wondering that there might be something here with Todd's, like, build it and bring it in and make it, it's already mine, where it would be more of a shell that you would go into. And I don't know, my mind is rapidly going now, thinking that might be something that in the future would be something that would be adaptable to disabilities like Anne's that progresses over time, but also to the ones that we have. Interesting.
Well,
Okay.
I mean, aging in place. I mean, we're hopefully we get to age in place for a long time, but as time goes on, we all slow down. We all need, we'll have different needs as life goes on.
Yeah, that's true. If we're lucky enough to age in place, yes, we
Yes, if we're lucky enough.
yes, if we're lucky enough. Okay, I'm going to ask some specific questions now to each of the panelists, and I'll start with Anne. And we talked about visitability, being able to just not navigate our homes, but our neighbors and neighborhood. Has your disability limited your access to your neighbors?
Yes, that's not being able to visit people is one of the biggest frustrations of my life, really. In my neighborhood, I live in a small neighborhood. We all know each other. We have parties at each other's houses for the holidays and stuff. And sometimes I can't go to the holiday parties because I can't get in. And my neighbors are my friends, and so I have people to help me, but sometimes it's just not possible. There are 3 houses in the neighborhood I can get into. One is owned by, she's a widow, and her husband was older than her, and he was in a wheelchair, so I was able to get into that one. Another one, a physician and his wife moved in, and they remodeled a house to age in place, so I got into their house for a party. Another one I think just had like 1 step, and then he made a little ramp for me. But basically, I can't visit people. There's very little spontaneity when you're in a wheelchair. So it's a really big deal, to go somewhere. That's not like a restaurant or an event where everything's accessible. I have a book group, and I know them for a long time. So what I did with them, most of them live in places with 1 or 2 steps, and I gave everybody a piece of plywood. And so that everybody has like a temporary ramp that I can use when I go, and that they just put the piece of plywood over their steps. So that worked well.
Well, you're creative, Anne. I've not thought of that, but I mean, it can be definitely isolating when you can't access other people's homes in the community. And I think
there's no popping in anywhere. You can't pop when you're in a wheelchair. There's no spontaneity.
Yeah, and it's even if you can get in, how long can you stay? I had a family member that built a house, and it was semi-accessible. I'm going to use Chris's word, semi-accessible. 1 step, I'd need a bump up to get into it. But unfortunately, I couldn't stay the length of the parties that we had, and we did have really good parties, and it lasted a while. But I couldn't stay that length because of the bathroom issue. There was no way. And people were like, oh, we can get you in there. I'm not sure I just want to be handled in there, because that could be dangerous for myself and for the person. I'm not like, I'd like to be 120 pounds, but I'm not. So, I mean, this would be a wrestle, and something that someone would really need to think about. And I know that they felt awkward about it, and I felt awkward about it. And so the socialization piece, I think because when you have a disability, it can be isolating on its own, right? But then when you add it into these built barriers that people want you over, but they can't have you over because of this. And I think many people on the screen today, if you thought about having this group, this group here to your house, how would that work? One of us would probably be terrifying. The four of us would be like, whoa, no, we can't get them in the door. And then they won't be able to stay long because we can't access.
Yeah, I forgot to mention the bathroom thing is a really big issue, because I cannot, I really have to time my visits. And I can't stay overnight at anybody's house either. And, that's kind of a concern, because I live in a flood zone. And so oftentimes, like when it's raining a lot, I'm thinking, oh, what if I have to go somewhere? There's no friend I can go to and stay at their house, because even if I can't get in their house, they don't have a bathroom for me. So I can only stay at anybody's house for a social event or something for, just a limited amount of time. I have to plan around it.
Well, and if, God forbid, there's a flood over there, you can come over here. We have an extra room. So take that off your worry list. Okay, thank you for sharing, Anne. Chris, I have a question for you, and it goes like this. What has your experience been on waiting list for accessible housing?
Well, I had a unique experience because I had to be in a nursing home for an extended period of time with some extended health issues that I had no control over. And so when I went to apply for, the housing situation, I finally got approved and found out that I was approved 5 months earlier, but my application was sitting on someone's desk who was no longer working there. And then you wait years to get these approvals, and then they give you such a small pocket of window to find a place. And I made the mistake of looking for places before I was approved. And the reason I said it's a mistake is because I found a great place, but they don't hold stuff for you. So that was kind of a big issue. I had another complex that I was on a waiting list for, and if you refused 3 times on what they offered you, you had to go back to the back of the list. Well, the first one that they offered me was on the 2nd floor with no elevators. And I said, I couldn't do that. And they counted that as a refusal.
Oh,
It just made 0 sense. And, but there was like, they just said that there was nothing they could do. That's just what their policy says. And obviously they didn't get my business because I just decided to go elsewhere. But it's again, going back to that mentality of what accessible means and what people needs really are. And we're not asking for a lot. It's very minimal, but it's just things that people don't know. I use the term ignorant, and I don't mean that in a derogatory way, but just the lack of knowledge of what accessible really means. And so I think there's just a lot of, that's why I agreed to be on this panel. I think stuff like this is great. It helps educate people onto what actually is the actual need. What you read, what you see is not always what's the truth. Especially nowadays with so many avenues of quote unquote media and access to information that may or may not be true. I think hearing it from the source, like the 4 of us, is key to helping.
So in amount of time, how long did you actually end up being on a waiting list?
It was a couple of years. I don't know the exact time, but I know like right now, I think the wait list is like 40,000 people on that wait list. And that's just to get approved for housing. That's not including turning around and trying to find something accessible on top of that. So that's the housing doctrine through like the Bear County Housing Authority. Because I get calls all the time about asking about that, and I really it's really hard because again I think right now only 5% of the apartments or units are required to be quote unquote accessible, and when you have over 20% of the population identifying as disabled, that gap is just a really big gap that is hard to fill.
Agreed. We definitely have a housing crisis in San Antonio, and it's worse for people with disabilities or people that need accessible housing. It just is. Thanks for sharing that, Chris. Todd, what has been your experience with home modifications in your current living arrangements? Just if you want to go back into, how did you start the discussion with the people you're with now at the apartment? Were they, as soon as you got there and said, hey, I'm going to need some modifications, were they like, okay, we can do this, or not sure about this?
Well, I mean, there's a lot of gray area. When I've owned homes, I sold my last home about 4 years ago, and that's when I decided to move downtown to be more in that walkable, more in that area where, I mean, just quality of life. So I moved downtown, and that's when I found out that there's just a lot of gray area between who pays for what, whether it's the apartment owner, the renter. And at that point, I reached out to some friends, Deborah being one with the City of San Antonio Disability Office. Also reached out to Tori, who's the director of the local AIA, American Institute of Architects. Just started asking questions. And then we, brought others in, Maylene and others, and we had a big roundtable discussion with a lot of very smart people involved in this. And there was still a lot of, at the end of that meeting, a lot of questions went unanswered because there's just a lot of gray area. So that's why these panels and these discussions and what we're working towards today is so important to try to clarify this, whether it's through mandates and or just education for everybody to try to step forward with best practice. But for me, I mean, some of the apartments are accepting and want to help, and others are not. My previous apartment, which I don't want to name names, but was one of the premier residents here in San Antonio in a new building, they were not as acceptable to helping out, to putting electric door openers, doing some of the things that really help. And now my new apartment complex, which isn't too far away from the previous one, they've been very helpful. Access is just one thing, but then, for instance, being able to come and go from my apartment, I mean, obviously that's extremely important, but then the daily wear and tear on the body to having to open up, gates and different things like that can really take a toll on somebody. So, if they'll work with you and add a simple electric opener, that makes it easier for me, as well. It makes it easier for the other residents who might walk up to that gate with a handful of groceries and bags, etc. So, going back, there's just a lot of gray area at this point. Who pays for what, how it's paid for, and when it's paid for, etc.
It's definitely a lot of, yes, go ahead, Chris.
I wanted just to interject too that accessible housing doesn't necessarily translate into low income as well. There's a lot of that stigma that people with disabilities are, fixed incomes, or they're on, poverty level, and that's not always the case. We have, our demographic is just like the regular population of people, where we have people that are, well off and with a disability, those that do need help. But I think there's that stigma that, low income is people with disabilities are low income, and there may be that discrimination of not wanting that kind of people in our specific area. And just another observation that I wanted to share.
And I certainly agree with Chris on that. And that's a big part and a big reason why I started to push this. I mean, where I live, again, on the river, it's a great location. And for, a lot of our elderly folks, which I'm getting, I'm mid 50s now. But, as people are downsizing, they're wanting to move to more, of these multifamily housing type places. And they're going to be faced with the same challenges that we're faced with today. And the more we can get architects, the more we can get developers to think about this. Again, universal design. If it works for us, it's going to work for everybody. The more people we can get to, on this bandwagon, on this, thought process of making things universally accessible for all, the better off I think everybody will be. And then that helps our visibility. That helps, all aspects of just people's lives, whether it's us with mobility issues and or, folks that as we age have more concerns on, getting to point A to B.
These are good points. I always say that, as a person with a disability, I want to blend in, not stick out. And I want to have the same access that anybody else has. And when I say blend in, I want it not to be a big deal for me to show up somewhere, or things have to be moved or adapted. That doesn't make me feel good. Doesn't make the host or the people I'm with good, feel good. It's an awkwardness. Just, wanting to be able to sort of blend in and just have the same basic access.
But Jane, that won't work because, not many people speak up like we do.
Yeah.
And, as we take classes or, go to the, as Area Foundation, we're the only ones in chairs probably 90% of the time. So my unique perspective is, as ironic as it sounds, my wheelchair helps me stand out because, we're able to bring this awareness in a different perspective for those. And so just being present has an impact out in the community, period.
Yeah, I think Chris and I are both pretty bullheaded that we'll force our way in. We'll get there somehow, some way. But, I think of the elderly folks, grandma, grandpa that go out to dinner with the family. And as you said, Jane, it's a hassle. And, and then that's going to keep them from wanting to go to dinner the next time or the next time. And then after that happens, 1, 2, 3 times, then that becomes the decline of grandma and grandpa not being able to interact with their family, not being, able to feel like they're part of the family. And, that leads to a spiral downfall, whether it's mentally, physically, it's just not a good thing. So the more access for all is better for everybody.
That's it. Access for all.
We've gotten to the 11:50 mark. And sorry, I'm navigating 2 computers because one of them froze, the main one. And I just want to thank everybody for participating today. Panelists, we're getting some great feedback in the chat. This has been a wonderfully received conversation, great information. The recording of today's panel discussion will be available on the Disability SA website. And we'll send a link out. I know that we'll have, it looks like from the chat, we might have a resource list that will be going out. And then again, if you have a question in the chat that wasn't answered in today's discussion, we'll be happy to forward you a response to that as well. We do invite everyone to join us again for a panel of individuals who live with cognitive disabilities on November 18th. If you didn't check the box in your original registration, just hop back into the registration page and feel free to do that again. We'd love for you to join us for any or all of the upcoming sessions. And then in January, we will close out the series with a strategies discussion on housing and the disability lived experience. So again, well, thank you so much for joining us today. resources will be coming your way, links and recordings available, and we hope that you absorb this information and share it with others so that we can work towards a San Antonio that is a better place to live for everyone. Thank you. Bye.